So we can all agree that our healthcare system doesn't work very well for people who are addressing a shift in their mental wellness. The A.B. Corker Foundation works as a bridge to establish partnerships, and we do that locally, nationally, and internationally, to target mental health and wellness. So our aim is to be as impactful as possible, and we start that by being a very lean organization. Our CEO and our board of directors are unpaid volunteers, and there's only one paid position within the foundation. This allows us to take our funds and turn those right back into the community. And we do that in several different ways. First off, by broadening education and access. So we support integration of behavioral health services into primary care. We have a partnership with ProHealthCare Foundation, where patients that go in for a primary care visit are also going to have their behavioral issues addressed. So this brings the patient well-being up, and it takes our medical costs down. Another thing in education and access is we provide mental health care literacy in college education through a partnership with Carroll University. In this situation, occupational therapists, physical therapists, and undergraduate nursing students get a broad knowledge about mental health and wellness, and then they integrate into communities where mental health care may not be available. So they add another level of availability and access. Some of the other scholarships that we provide are for mental health care education and training at Marquette University. Now, these are psychology grad students that become board certified behavioral analysts. Now, many of these graduate students are already from underserved populations, and their intent is to go back into those communities after they graduate. Working with UW-Milwaukee and UW-Madison, we offer scholarships to nurse practitioners and physician's assistants to add a mental health certification to their training. So this all gives us more providers at many different levels that understand mental health and wellness. We also promote early prevention, detection, and treatment. So we provide financial support for the Penfield Clinic's program that deals with behavioral health for children ages 0 to 6. It's an amazing program where care is offered in the home and includes the entire family. In the Milwaukee area, we have the Hope Squad. This is in middle and high schools here in the Milwaukee area. And the Hope Squad is a peer-to-peer training that helps reduce the incidences of suicide in youth. Funding for direct care and research is another critical part that we do. So we have an organization internationally, the Karam Foundation, that is currently serving refugees and displaced families who have suffered incredible trauma, fear, and loss. And they're delivering services in Turkey right now to those families. Here within Wisconsin, we work with the Medical College of Wisconsin, and we just instituted 4 new programs that are going to address the needs of frontline and essential workers and also their families in addressing their mental health care needs. Research is critical, research is key. So we support the research and the work of existing mental health organizations and foundations. So for example, the Brain Research Foundation, Mental Health America, NAMI, the National Alliance of Mental Health, those all have national and state programs that we support, the International OCD Foundation, and others. So by taking things one step at a time and sharing our vision, joining together with these incredible partners, we can make the world a better place for adults and children with ill mental health.